Hi, it's Dr. Amy with Amethyst Wellness. I'm here with Jerry, and we're going to talk today a little bit about hormone optimization using bioidentical hormones and the effects on the immune system. As you know, at Amethyst Wellness, we provide BioT, bioidentical hormone replacement, which helps the body return to its normal hormonal state. And we use the right kind of hormone, bioidenticals. And we're going to talk more in depth about what BioT is in a different presentation, but it's really important to note that we're using bioidentical hormones, which are different than synthetic hormones. So a lot of the bad press that hormones get are because of that misunderstanding. It's also using the right amounts of the hormones, and that's using the BioT method, which makes us different from perhaps some other pellet providers. And we use pellets, and there is a reason why pellet therapy is just superior to other hormone delivery methods.
And being that we're with BioT, we can be assured of the quality. All pellets are not created the same, and also the consistency, because there's a method, the BioT method, and it's been proven effective on over, 1.4 million insertions with thousands of providers.
Every time the number just increases. So we feel very comfortable knowing that this therapy has been used on millions, literally millions of people. And we have this very large network of providers and support. So whenever we do encounter something that we're not familiar with, there's someone out there who has seen it. So bioidentical therapy is administered to men and women. It consists of bioidentical testosterone and sometimes estradiol if a woman is in menopause and she needs it. The dose is based on your age, your weight, your labs, and your symptoms. And that's probably the most important point is we look at the labs, it helps to guide us, but really we determine the effectiveness of therapy based on how you feel.
That's what's really great about it too, is that as clinicians that are specifically trained and certified by BioT, we have the ability, we use their method as a framework, but we also can vary that a little bit based on the patient's specific needs. So it's tailored for each patient. So because you get something doesn't necessarily mean that your friend, that it would work for them
either. They won't necessarily get the same thing. Okay, so pellets have been around for more than 75 years. It was actually the original method of hormone replacement in menopausal women. It went out of favor as certain medications were developed and patented. And then Big Pharma got involved, and that's where Premarin came from, which at the time they thought was a good thing. When I first started in nursing years ago, I worked in cardiology, and every single woman was put on Premarin because we thought that was good for them, right? And then we learned later that no, it's not.
And Big Pharma learned that you can't patent what God already has a patent on.
Right, which is why pellets are not FDA approved. However, the ingredients are.
Right.
So it's important to note pellets have been around for a very long time, and bioidentical hormones do not increase your risk of cancer. It does not increase your risk of blood clot or stroke, and it's actually protective to the breast and the bones, and it helps prevent Alzheimer's and protects the heart. So people come to us because they're feeling bad.
As a matter of fact, there's some oncologists out there who use testosterone pellets to help shrink certain tumors. So,
that's pretty compelling. Okay, so bioidentical hormones also protect against other diseases. We talked about the heart and the brain. It increases bone density by 8 times, and I have seen that in practice. I've seen women have an improvement in their bone density after about 2 years of therapy. So it's not overnight, but it does rebuild bone, which is awesome. So other benefits of hormone optimization, it increases well-being, and especially right now, that's so important for us to feel our best. It helps people sleep, and when you sleep, that's vitally important for your immune system.
As we're talking right now about this COVID-19 situation, optimizing your hormone levels is incredibly important. Getting the proper amount of sleep helps your immune system to stay active. Getting the right nutraceuticals is very important as well, making sure that all those things are in balance, including your thyroid, which we'll talk about after.
Right, and stress reduction. If you haven't checked it out yet, we have another video featuring Jerry and guided meditation and breathing and how that's so important to manage our stress during uncertain times. Always, of course, but right now it's especially important.
It's kind of gratifying now as I watch like the Wild Health teleconference that they've been having this week, and all the doctors focusing in on people like Andrew Weil and meditation and looking for things for themselves and for their patients to stay calm during this period. It's something that we've known for a very long time, but it's nice to see the medical community starting to embrace these alternative techniques.
Okay, so let's talk about the thyroid. Thyroid optimization is a part of the Bioidentical method. It's something that we test and then we make recommendations and sometimes prescriptions. We usually prescribe a natural thyroid prescription that has just thyroid hormone in it, T4 and T3. When our thyroids are optimized, it helps improve our white blood cell function, which those are the guys you want to destroy viruses when you're attacked by something. And we specifically focus on your T3 levels, which makes Bioidentical a little different from perhaps some traditional practices. So basically your thyroid is a gland in your neck, and it makes T4 hormone, which is converted to T3 in the body. And we find that a lot of people just don't convert properly for a variety of reasons, environmental factors, and just suboptimal thyroid function. So when we look at optimizing your thyroid, we really look at your T3 levels and try to get you into a certain window there. And the T3 is responsible for the promotion of mature immune cells.
Whereas when you're taking something like Synthroid or levothyroxine, which we've traditionally, I prescribed it for many, many years, you're only getting T4. That the body has to go ahead then and convert that over to T3 before it can be utilized in most parts of the body.
Right. Many times that just doesn't happen, so we can have people that have normal labs and they look fine, but they don't feel fine. They have a lot of symptoms of hypothyroidism, but they can't really get the help they need because their labs look normal. Right? And so we look at things just a little differently, and we find that optimizing that thyroid can help with energy, help with weight, and now with the immune system as well. Okay, so now we're going to talk about vitamins and supplements and how they can affect your immune system. So part of the Bioidentical protocol, sometimes we recommend iodine. The Bioidentical formula of iodine also includes zinc and selenium. So first of all, iodine is important for healthy thyroid function. Our thyroids tend to get, there's so much contamination in the environment that our thyroid gland can become saturated with something called bromine. It's bromine, right? And that just makes it not function very well. So when we take iodine, it kicks the bromine off, and the thyroid becomes saturated with the iodine, and it makes it happier and makes it work better. With this formulation of iodine, it has zinc in it as well. And most people are aware that zinc can help reduce the severity of a viral illness, and it makes your lung tissue healthier and helps prevent inflammation and infection.
And thyroid. It's essential for proper absorption of iodine.
Okay, now we're going to talk about vitamin D. So our ADK formulas contain vitamin A, which is important for the stability of the D3. It also has K2 in it, which is great for bone health. But the D3, if you have, and we see a lot of vitamin D deficiency, if you are deficient, you have an increased risk of illness and cancer and all these other things. So vitamin D optimization is very important.
Absolutely, and vitamin D has been shown to increase a peptide, which all of you know by now is my specialty, called LL37 in the gut. LL37 is essential for proper immune function, and having your levels higher of vitamin D and glutathione, by the way, helps to you to produce your own endogenous LL37. I'm recommending right now, there are very few of you out there who are going to become toxic on vitamin D. I've seen your levels, and so the truth of the matter is bumping up your vitamin D now at this point to 5,000, 10,000 international units per day. I highly recommend, as long as the COVID-19 situation persists.
Probiotics. Almost all of us should be on some kind of probiotic, and even before all this, just gut health is just linked to healthy immunity, but it's also linked to healthy mood and overall well-being. So probiotics have been shown to reduce the incidence of upper respiratory infections.
Also reducing anxiety, depression. They're saying that your stomach is your second gut, and there are many people saying that's your second gut, your second brain.
First gut.
I might need a second brain.
Yeah.
But it's actually, some people are saying it's actually the primary. When your the organisms in your gut, when they're out of whack, feelings of anxiety. The microbiome, thank you.
Took a minute.
Mine might be out of whack right now. But those things are essential for calming the immune system, making the immune system work properly, reducing anxiety and depression.
So in summary, there are many benefits of bioidentical hormone optimization as well as nutritional support. Increased quality of life is always important, prevention of disease, and now enhanced immune function. Feel free to reach out to us at any time at 386-283-4180, or you can contact us through our website online, amethystwellness.com. Thanks for tuning in.
Thanks.